What are schwannomas brain tumors? Imagine a tiny cell that helps protect your nerves by wrapping them in a protective layer. Sometimes, these cells can grow into a tumor called a schwannoma. These tumors start from Schwann cells, which are responsible for making the myelin sheath that covers nerves outside the brain and spinal cord. When a schwannoma develops in the brain or near nerves, it is usually slow-growing and considered benign, meaning it is not cancerous. Most schwannomas are classified as low-grade tumors, which means they grow very slowly and are unlikely to spread to other parts of the body. Schwannomas can form on any nerve covered by Schwann cells, but they are most often found on the vestibulocochlear nerve. This nerve connects the brain to the ear and controls hearing and balance. When a schwannoma develops on this nerve, it is often called a vestibular schwannoma or acoustic neuroma. Because these tumors grow slowly, they might stay hidden for years without causing any symptoms. However, as they grow larger, they can start to press on nearby nerves and tissues, leading to various symptoms. Common signs of schwannomas include hearing loss, usually affecting one ear, and ringing or buzzing sounds known as tinnitus. Some people experience difficulty with balance, dizziness, or vertigo. If the tumor affects the facial nerve, it can cause numbness, weakness, or pain in the face. In cases where peripheral nerves are involved, symptoms might include muscle weakness, numbness, or tingling in the limbs. Sometimes, a visible lump under the skin can be felt, especially if the tumor develops outside the brain. Depending on where the tumor is located, other symptoms like headaches, poor coordination, or trouble swallowing may also occur. The exact cause of schwannomas is not fully understood. Most cases happen randomly without a clear reason. However, genetic factors can increase the risk. Changes or mutations in the NF2 gene on chromosome 22 are linked to conditions like neurofibromatosis type 2 and schwannomatosis, which make developing schwannomas more likely. Environmental factors such as previous radiation exposure might also play a role in some cases. To diagnose a schwannoma, doctors typically use imaging tests like magnetic resonance imaging or computed tomography scans. These scans help visualize the tumor size and exact location. Sometimes, a biopsy is needed, where a small sample of tissue is examined under a microscope to confirm the diagnosis. Treatment options depend on the size of the tumor, its growth rate, and the symptoms it causes. Small tumors that are not causing problems may just be monitored over time with regular scans. If the tumor is larger or causing significant symptoms, surgery might be recommended to remove it. Radiation therapy can also be used to shrink or control the tumor's growth. Because schwannomas are usually benign and grow slowly, the goal of treatment is to reduce symptoms and preserve nerve function while minimizing risks. In the context of brain health, schwannomas are a less common type of brain tumor that generally do not spread or become cancerous. Still, they can affect quality of life by impacting nerve functions like hearing or balance. Early detection and treatment by healthcare professionals specializing in brain and nerve conditions are very important. If you experience symptoms such as hearing loss, dizziness, or unexplained neurological changes, seeking medical advice promptly can lead to better outcomes. Remember, each case is unique, and personalized care is essential for managing these tumors effectively.